Hi, I'm Dr. Jeffrey Olin. I'm a professor of medicine in the Cardiovascular Institute, and I direct vascular medicine and the vascular diagnostic laboratory. FMD stands for fibromuscular dysplasia, and it's a condition that affects the arteries, predominantly in women between the ages of 20 to, let's say, 70 or 80. And instead of the arteries being straight, they look like a string of beads. SCAD, on the other hand, is spontaneous coronary artery dissection. That's where the arteries in the heart tear, and it often leads to a heart attack. It occurs also in women in the prime of their life. The two conditions go together: coronary artery dissection and fibromuscular dysplasia. It should be noted that people with fibromuscular dysplasia, about 25 to 30% have a dissection in some artery, usually the coronary arteries or the carotid arteries. And about 30% have an aneurysm or an enlargement of the arteries in some location in their body. We've made a tremendous amount of progress in the last year regarding identification and awareness of fibromuscular dysplasia. This is in a large part due to the United States Registry for Fibromuscular Dysplasia. And I should note that this registry is supported entirely by patients who have fibromuscular dysplasia. We now have over 3,000 patients in the registry and multiple centers throughout the United States. And it's through this mechanism that we've learned a lot about the phenotype of fibromuscular dysplasia. What that means is how patients with fibromuscular dysplasia present and what kinds of complications they can develop in the future and ways to identify and prevent those complications. So there's been a lot of progress in that area, and multiple publications have come out of the United States Registry. Additionally, we published the first international consensus document on fibromuscular dysplasia. I'm particularly proud of a paper that we published called Plasma Proteogenomic Signature of Fibromuscular Dysplasia. And this particular paper is an early result of what it would look like to have a blood test for fibromuscular dysplasia. It's interesting to note that patients who have fibromuscular dysplasia have helped each other deal with this condition. And this group of patients often does a lot of research, and they actually educate other physicians on manifestations of fibromuscular dysplasia, which many consider to be an uncommon disease. We think it's much more common than previously thought. There's no way to prevent fibromuscular dysplasia or to prevent spontaneous coronary artery dissection. These are genetic diseases, and that's some of the work that we've been doing to try and identify the genes. But once you experience a dissection, for example, SCAD, there are things you can do to prevent another episode from occurring. Things such as doing as much as you can to control stress, avoiding activities that markedly increase your blood pressure, such as heavy weightlifting or other isometric activities such as push-ups, sit-ups, planks, etc. The other aspect of this is it's important to control the blood pressure. Now, many times fibromuscular dysplasia affects the arteries to the kidney, and doing a balloon dilatation or a balloon angioplasty can improve blood pressure control. But most patients still will need medication, and it's important to control the blood pressure so as to prevent things like dissection and aneurysm and stroke from occurring. The most common manifestations of fibromuscular dysplasia are high blood pressure, migraine headaches, a condition called pulsatile tinnitus, where you hear a swooshing or whooshing sound in the ear. So with every heartbeat, you would hear whoosh, whoosh, whoosh. If you have any of these manifestations, it's important to see a physician who's familiar with fibromuscular dysplasia so you can be properly evaluated. SCAD, on the other hand, the most common presentation is chest pain. And it could be chest pain, pressure, tightness, sweating. The discomfort could be in the middle of the chest and go down either of the arms. In this situation, you need to call 911 and present to the emergency department as soon as possible so that you can be evaluated and treated to prevent any long-lasting adverse effects on the heart. We've received a lot of email and telephone calls about what patients with FMD or SCAD should do regarding the COVID-19 pandemic. There's no evidence that patients who have fibromuscular dysplasia or spontaneous coronary dissection are at a higher risk of getting COVID. And there's no information that shows that if you do get COVID, that your outcome is any worse than a patient who does not have fibromuscular dysplasia. And it appears that antibody levels decline as time goes on after the second injection for those who receive 2 injections. We follow the recommendations of the CDC, and therefore, if they are recommending booster shots, we also are recommending booster shots for our patients with fibromuscular dysplasia or SCAD. We are in need of additional funding in order to continue our genetic research and our phenotypic research so we can find a causative gene that causes this condition and a way to block the action of that gene and cure patients who have fibromuscular dysplasia and prevent spontaneous coronary artery dissections. We would greatly appreciate donations to our research program in fibromuscular dysplasia so that we can not only help patients who have fibromuscular dysplasia, but also family members who may ultimately develop fibromuscular dysplasia.